It's nice to have you join me again on this week's episode of Health Business. I'm your host, Oluwatoyin Kolawole. Our focus on the program this morning is the reintroduction of the Global Gag Rule by the United States President Donald Trump and how it affects the health of Nigerian women. Please watch this documentary and get more information.
According to data collected in 2016 by the Nigeria National Bureau of Statistics, the total population of citizens in Nigeria is estimated to be over 195.8 million. And with more than 5 million women living an average lifespan of 55 years. This very low number has been attributed to many health issues plaguing the female gender in the country. Leading this pack are high maternal mortality rates as a result from complications during pregnancy, cancer of different types, and unsafe abortion. While pregnancy is obviously not a disease by any means, a lot of expectant mothers in Nigeria die from pregnancy complications every year. A Nigerian woman's chances of death during pregnancy or childbirth is 1 in 13. Some of these women, most especially the ones in rural areas, do not have access to seek professional medical attention. In a bid to stem the tide of complications in pregnancy, the federal government has continually advised women on the need for family planning, and with the help of some donor agencies like United Nations Population Fund, UNFPA. Up until last year, these donor agencies received grants from the United States government, and other sources and family planning clinics were run in different centers in Nigerian hospitals. But when President Donald Trump reintroduced the Global Gag Rule, which forbids any non-governmental organization from receiving U.S. global health funds and from using even their own non-U.S. funding for contraceptives, provision for legal abortion services, information or referrals. This policy also bans NGOs from engaging in advocacy to expand abortion access within their own country. The extended version of the policy affects almost $9 billion in funding that covers a vast array of programs including HIV/AIDS, malaria, tuberculosis, water, sanitation, and maternal and child health, in addition to family planning and reproductive health. Since the reintroduction of this policy, there has been reduction in family planning commodities, and many women find it difficult to access these commodities. This is Oriba, a riverine town in Ekpe local government area of Lagos State, southwest Nigeria. Health Business found out that maternal death is on the rise here due to the fact that there are no skilled health workers to attend to pregnant women and assist them during labor. Also, most of the NGOs that come to offer family planning facilities stopped a year ago.
I am the traditional midwife in Oriba community. We want the government to send qualified nurses to assist us here. I am the only person in this town that takes delivery of all the pregnant women here. If we have some qualified nurses, they can handle delivery cases that I cannot handle. But I thank God that since I have been doing this, I have not encountered a difficult case because I learned from my mother, who also learned from her mother. God will not let me encounter a difficult case that I cannot handle.
Medical practitioners noted that now that the Trump administration has cut off the funding on family planning and safe abortion services, it's important for Nigerian government to increase funding for family planning so as to reduce maternal mortality rate in the country.
I think it is high time Nigerian government should continue to look inwardly and see that we have to be visionary. We have been talking about, economic problem in Nigeria. The issue of having many children contributes to this. A lot of women have died due to unwanted pregnancy. So I don't know if government will not be looking towards this of reducing. If we are very specific about maternal mortality rate, government should look at it that you should do something fast to enhance the safety and good health of the women in Nigeria. And how can we do this? There are a lot of wastages Nigeria government, I think, they are making. And if you can, try to, review all those areas we are making wastages, we can divert these resources to how to really care for health matters in Nigeria, especially issue regarding women, as issue of delivery, reproductive. And if you are able to do this, there will be a reduced maternal mortality rate in Nigeria.
Medical practitioners also reel out the importance of family planning in the reduction of maternal mortality.
Family planning is actually a method of reducing unplanned pregnancies, and is actually a key factor in maternal mortality reduction for many reasons. One key reason is because when a woman spaces her child properly, she's able to rest well, she's able to take care of herself. The World Health Organization has recommended at least 2 years spacing between each pregnancies. And once a woman is able to do this, all the physiological changes of pregnancies will be back to normal. The blood will be back to normal, her uterus would have come back to normal. And in doing this, her body would have rested effectively. Once she can do this, and once she can do this, she's assured of a safe future pregnancy. And how do we do this effectively? One key way is by family planning. And we always talk about children by choice, not by chance. In this 2-year period, a woman is expected to use an effective method. And the truth is, there is a method that best suits everybody. Once you can use a method adequately within this 2 periods of rest, you are rest assured that you're not going to get pregnant. One key thing about family planning is that it will help you to plan properly. Women, and you reduce repeated pregnancies. Once a woman is having repeated pregnancies, all the complications of pregnancies come in. All the complications of things that can cause maternal mortality would also come into play. Some women, that even married women that have unintended pregnancies, most times they resort to unsafe abortions. Unsafe abortion is now the 3rd leading cause of maternal mortality because she goes outside to receive it, and also because abortion is not legalized in Nigeria, which means that she would go outside to quacks to get the service, and it can lead to her death.
A Stanford University study shows that across 20 African countries, abortion rates increased under a previous introduction of the global gag rule. An estimated 78,000 women die each year globally, and millions are injured from unsafe abortions. Such tragedies could be virtually eliminated by the provision of proper health information and unhindered access to family planning commodities. Reproductive health experts are of the opinion that the U.S. government must conduct a review of this policy through a comprehensive, transparent, and consultative process that includes civil society and takes action on the policies and challenges identified during the review process.
It's important that government at all levels need to allocate more funds into family planning services so as to reduce maternal mortality ratio in Nigeria. Next on the lineup is the news. Stay tuned.
Reactions are still trailing the ban of codeine-containing drugs in Nigeria. Pharmacists in Lagos say government are just paying lip service to the regulatory framework in the drug distribution guidelines. They noted that instead of banning the drug, a recall of the product was supposed to be carried out first. While addressing health journalists in Lagos, these pharmacists say the way forward in curbing the trend of drug abuse is to adopt a prescription policy.
The decision to ban codeine-containing cough syrups taken by the federal government as a way to curtail abuse of this product is certainly not the right way to go. It is tantamount to cutting branches of a tree, hoping to eliminate or kill the tree. To us as ACPN Lagos, the ban wouldn't achieve much. It will only result in pushing up the acquisition costs of these products, since the whole available stocks that have not been mopped up from the market will now be sold secretly by charlatans. Secondly, the outright ban of these products have denied some citizens of this country access to medications that are needed to cater for their health, as not everyone using this medication abuses it.
Over the years, we have had a very weak regulatory framework, and this must be overhauled if we want to win the war against drug abuse, if we want to win the war against drug misuse. And I want to tell you, it's not just about codeine. Tramadol in Nigeria, they are 750 milligrams being sold, not registered. Where are they coming from? What about all these porous borders? These people hawking drugs on the street, what are we doing about them? That means there has to be a re-engineering of our regulatory bodies so that they can do what they have been established to do.
Everything boils down to the government. Let the government do what he is supposed to do and punish erring officers, erring members, anybody that is doing what it's not supposed to do. The government has the power to punish, but they are not doing that. So where are we? Fire brigade. Because somebody has taken and put us in the limelight, the whole world is now seeing what is going on. Are we saying we don't know about drug abuse over 5-6 years that PSN, ACPN, that is professional bodies of the pharmacies have been shouting before it escalated to this level? We've been talking about it and everybody pretend that it's nothing.
The pharmacists, however, advised the federal government to constitute the Board of Pharmacists Council of Nigeria so as to pave way for discipline of any erring member of the pharmacy profession that violate laws guiding distribution and dispensing of these drugs.
On Mother and Child segments this week, we'll be educating mothers on the importance of immunization for babies. Stay tuned.
Parents always want to do everything possible to make sure their children are healthy and protected from preventable diseases. Vaccination is the best way to do that. Vaccination protects children from serious illness, complications of vaccine-preventable diseases, which can include amputation of an arm or leg, paralysis of limbs, hearing loss, convulsion, brain damage, and even death. Vaccine-preventable diseases such as measles, mumps, whooping cough, and polio are still a threat in most developing countries in Africa. Although vaccination has led to a dramatic decline in the number of cases of several infectious diseases. Some of these diseases are still quite common in many African countries. Outbreaks of preventable diseases occur when many parents decide not to vaccinate their children. Medical experts have proved that vaccination is safe and effective because all vaccines undergo long and careful review by scientists, doctors, and the federal government to make sure they are safe. If children are not vaccinated, they can spread diseases to other children who are too young to be vaccinated or to people with weakened immune systems. This could result in long-term complications and even death of these vulnerable people. Mothers, now that you know the importance of vaccination, ensure you visit primary health care centers near you and vaccinate your children from preventable diseases.
Are you a lover of pets? Do you have pets? Do you seek expert opinion on how to take good care of your pets? Well, this next segment is specially designed for you. Stay tuned.
Good day, viewers. I'm Dr. Olatunji Nasir. I'm the Medical Director of Truth Miles Animal Hospital. We are situated in Ikeja, number 75A Akanlako Crescent off Adeniyi Jones in Ikeja. I'm here to start talking to you about pets. When you talk about pets, what readily comes to mind is that adorable thing that you like. Something that you cannot do without, something that gives you joy, something that, when you see that thing, you are very high. I don't mean the high in the other sense of the high, but you're just very happy that, oh, this thing is around me. There are so many things that you can consider as a pet. Some men will consider women as pets, some will consider their children as pets, some women will consider some men as pets. So it depends. Husband-wife situation, boyfriend, girlfriend, and all that. But in this case, we're talking about animals, and the particular set of animals I'm talking about are the small animals, even though you can also have large animals as pets. But here, we shall be talking about dogs, cats, rabbits, snakes, monkeys, anything that you wish to consider as your pet. That is what I'll be talking about. And these are things, like I said earlier on, that are very, very when you see them, you are just like absolutely fine with yourself. How many kinds of pets do we have? Uncountable. Very, very uncountable. But in this climb, a lot of people talk about dogs. It's about dogs, they talk about dogs. Cats are not very favorable in the urban environment. But in our traditional setting, in the villages, we still have our mothers keeping pets. And mostly, we're talking about cats. Even though, as a veterinary doctor, we don't really see a lot of cats as our patients in Nigeria, at least Lagos, it's not the same as in the north. In the north, cats are still seen as pets. A lot of people keep cats as pets in the north. But in the southwestern Nigeria, and perhaps south and southeast, cats are not very, very, they're not animals that people consider as pets. I'm told that this is because of some supernatural myths, beliefs about cats, about them being harbingers of, I don't want to say it in the public space, but that is why we don't see a lot of cats around us here. But we see a lot of dogs, we see a lot of rabbits, we see a lot of other exotic pets, that people keep. And even people keep fish as pets. And I've encountered people who keep lion cubs too in this Lagos. So it actually depends on what makes you happy, that you want to keep as pet. It's not necessarily what some other people do. Now, why do you keep pets? It's a question I want to ask you as as somebody who is keeping a pet now or who is considering keeping a pet. Pets are kept for several reasons. Some people keep pets just to make sure that they have something they can relate to when they are alone with with that creature. Some keep pets because it's like a peer pressure thing. Oh, my friend has got a Rottweiler, my friend has got a Caucasian or something. I must also, have the same thing, peer pressure. Some will keep pets because of health reasons, and that is very profound. Because pets have been found to do a lot of things to the health of people. They give you a rest of mind. I'm told, and I know, that they also reduce blood pressure, because when you are with something that you love, you are tranquil, you're very nice at that particular point. Nothing worries you. You are happy with what you are saying. People with high blood pressure have been found, to have their blood pressure lowered, and they live very well because of their pets. A lot of people also keep pets. Well, do I say those are pets? When you have guard dogs in your house, that is not a pet, because that one just is simply a walking dog. It's a walking dog that you have employed as a security personnel in your house. So I wouldn't really regard those as pets, even though some people misconstrue the meaning of having a guard dog in the house, and then say, oh, you have a pet, and they'll be mentioning the name of the guard dog. I've told them often, that's your dog is not a pet. It's just a guard dog. So that's the thing. So I'm not saying those who have pets cannot necessarily use them as guard dog. Don't misconstrue it. But when it is employed as a pet, it's actually something that you use to, it's like your friend. It's something that some people, do you know that some people have their pets sleep on their beds? They sleep on their beds. So these are the things. There are some that will not keep their pets outside the confines of their home. And when I say their home, I mean within their flat, within their duplex, within their houses. They are not in the compound where there's a contraption called a kennel or just a part of the house where the dogs sleep. The dogs actually sleep in the house. Some will sleep in the same bedroom with their owners. Some will sleep in a separate room that is air conditioned, that you probably wonder, is this a dog having this kind of thing and all that? So those are the ones we consider pets. They are things that they make them happy. They are part of the family. That is the catch thing. These pets are parts of the family. When the family is budgeting for them, they are also budgeting for the family. They also budget for this pet. When they are budgeting for health, food, everything, these are budgeted. And the fathers and the mothers of those houses consider these as their sons and daughters. Nigerians will not want you to call them a pet parent, or pet parents, so to say. I've had some encounters with people when I say, oh, how is your dog? How is your dog? How is it doing? Some of them, why do you have to use he or she? It's it. And I say, no, because it's part of your family. I say, no. Those ones are not adequate pet lovers. They're not good pet lovers. I will not even say they are pet lovers in the first instance. Because when you are a pet lover, you will not hesitate to listen to someone calling your dog a son or a daughter. It might be like alien to our culture, but then a lot of people still agree that dogs or the pets you have can be considered as part of your family. So those are the people who I know are keeping pets. And like we said, you can keep your pets in a variety of ways. But let me ask you a question. Are you actually qualified to have a pet? Are you? Because it is not just a matter of fancy that you want to have a dog and then you get a dog. And no. That's not the thing. If you want to have a pet, there are certain qualifications that you must have. You must have the wherewithal. There must be adequate money, that you're going to use to take care of that pet. Because the pet is got to eat. You must not starve a pet simply because of the economic situation. It's not going to work. So you must provide for food at all times. You must provide for good housing at all times. You must provide for water at all times. You must provide for medicals at all times. You must allow the pets to be able to give a space that it will allow it to express its natural tendencies. Like for example, you have to allow a dog to bark but it must be controlled, you know. So that's why you have the issue of dog training and all sorts of things, because you must be qualified to have a pet. And then the kind of pet you have, your situation should dictate the kind of pet that you are going to have. I, for example, will not support somebody who lives in a flat keeping a big dog, like a Rottweiler or something, you know, because these dogs are boisterous. They need to, like, you know, express themselves. They need to walk, they need to run, they need to do everything, which cannot be done in the confines of your home. But if you allow them to be in the compound that you live with other people, there could be danger. They could bite people, they could constitute nuisance by defecating on the floor, urinating on the floor and all that. So it's going to like behooves you to at least take the kind of the size that you know you can keep within the house, you know, that will not be able to be nuisances to your neighbors and all that. So that is very important. So you can't just say because I like a Rottweiler or I like an Alsatian or I like a Boer Bull or something or a Doberman, then I live in a flat and it's all right for me to do that. Some people will go to the extent of, like, I've said it several times, building contraption called kennels in the compound, and then they lock these dogs up all throughout the day, leave them at night, and these guys are bored at night, they just destroy everything. So you must be prepared. There must be certain qualification for you, you know, to have a pet. If you're not going to have that, then I'm sorry, you don't have to have a pet. It's not compulsory. Then your time investment is also very important. If you don't have much time to invest in keeping your pet, don't try it, because you have to have time. You must be able to be the friend of that pet. You must be able to have time to play with that pet very well, so that the social skills of the pets are developed and they can then interact in human society, not that they are in the wild. It is because that's why a lot of dogs will continue to bite people everywhere, because they are not socially prepared to be in this society. So you must have time, you must have money, and you must have the will to be able to develop your pet into something that will be sociable. Now that we've been able to educate ourselves on what is a pet, why you need to have a pet, and what qualifies you to be a pet owner, I'm sure you've been educated on those broad subjects. Join me again on Vet 360 next week for another interesting topic. I remain Dr. Olatunji Nasir.
We've come to the end of today's package of Health Business. For sponsorship or advert placement, please call the numbers showing on your screen. I'm your host, Oluwatoyin Kolawole. Please save this program by advertising your products on this program. Remember, living healthy is a serious business. Bye for now. Thank you.